Hi, and welcome to Understanding Depression, a podcast where we talk openly and kindly about mental health, using everyday language and lots of empathy. Today's topic is something many people wonder about, but few fully understand. What is depression? And how is it different from the sadness we all feel from time to time? At first glance, they might look similar. After all, both involve low mood, tears, maybe a lack of motivation, but they're actually very different, both in cause and in impact. And learning how to tell them apart could be a life-changing insight, whether for yourself or for someone you care about. Stick around, because this conversation might help you see your own feelings with more clarity, or understand someone else's silent struggle a little more deeply. Let's start with something we all know. Sadness is part of being human. You might feel sad after a breakup, after losing someone you love, when you fail at something you really cared about, or even just on a bad day when things don't go your way. That sadness can be intense. It can make you cry, feel heavy, or want to be alone. But here's the key. It usually comes with a clear reason, and over time, it tends to fade. Even though it hurts, sadness usually moves with us. You might talk to a friend, watch your favorite movie, go for a walk, or simply give it a few days, and things start to feel a little lighter. You may not forget what happened, but you regain your strength. This kind of sadness is called a healthy emotional response. It's your heart reacting to something that matters, and it's totally okay. Have you ever felt that kind of sadness and then noticed how, little by little, life started to feel okay again? That's a great reminder that sadness, while painful, doesn't always mean something is wrong. So now, let's talk about the big question. What is depression? Depression is a medical condition. It's a serious mental health disorder that goes far beyond temporary sadness. It affects how you feel, how you think, and even how your body functions. And most importantly, it doesn't always have a clear reason. Someone with depression might wake up every day feeling hopeless, numb, or overwhelmed. They might lose interest in everything they used to enjoy. Life starts to feel heavy, pointless, or even painful. And unlike sadness, these feelings don't just go away with time. Let me share an example. Imagine someone named Dita. She has a job, friends, and a loving family. From the outside, everything looks fine, but inside, Dita feels completely empty. She no longer enjoys the things that used to bring her joy, music, sketching, or chatting with friends. She finds it hard to get out of bed, and even small tasks feel like mountains. Some days, she force à smile. Other days, she just shuts down. And in the quiet moments, a little voice in her head whispers things like, "You're not good enough," or "People would be better off without you." This is clinical depression, a disorder that can take root deep inside and start affecting everything, even when the person looks okay on the outside. Have you ever known someone who seemed fine but was clearly struggling underneath? Or maybe you felt that way yourself. If so, you're not alone. Let's keep going. This next part will help you spot the key differences. What makes depression different from ordinary sadness? Let's break it down even more deeply. Duration sadness is usually linked to an event and passes in days or weeks. Depression lasts at least 2 weeks, but often persists for months or even years if untreated. And the person may not know why they feel this way. The loss of joy becomes a constant, not a phase. Severity sadness might slow you down, but depression can stop you completely. Some people struggle to shower, eat, or get out of bed. Even smiling or answering a simple message can feel impossible. It's not laziness, it's the weight of the illness. Cognitive changes. Depression often brings cognitive distortions. These are thought patterns that are deeply negative and unrealistic. For example, "I'm a failure. Nothing will ever get better. I'm a burden to everyone." People with depression might struggle to remember things, concentrate, or make decisions. Even basic tasks like choosing what to wear can feel overwhelming. Biological and neurological impact. Unlike sadness, depression often comes with changes in brain chemistry. Neurotransmitters like serotonin, dopamine, and norepinephrine, which influence mood and motivation, are often imbalanced. That's why treatment sometimes includes medication to help restore these levels. It's not just in your head, it's in your biology too. Loss of pleasure. Anhedonia. Anhedonia is a core symptom of depression. It's the inability to feel joy from things that used to bring happiness. Imagine loving music your whole life, and suddenly, you hear your favorite song and feel nothing. That emotional flatness is devastating and hard to explain unless you felt it. Social withdrawal. Sadness might make you want company for comfort. Depression often pushes people to isolate themselves. They cancel plans, avoid calls, not because they don't care, but because they feel numb, ashamed, or exhausted. Sense of self and identity. In sadness, your self-esteem is usually intact. With depression, the illness attacks your sense of self-worth. People begin to believe lies like, "I'm unlovable," or "I'll never be okay." Depression distorts the mirror we use to see ourselves. Have you ever felt disconnected from who you used to be? That might be a sign that something deeper is going on inside. Let's also talk about a few harmful myths that make it harder for people to speak up. You just need to think positive. No. Depression isn't cured by positive thinking alone. It's not a mindset, it's a condition. If you can still work or smile, you can't be depressed. Wrong. Many people with depression are high-functioning. They perform well at work, help others, and smile in public, while suffering in silence. It's just a phase. For some, it's not. Depression can linger and worsen over time without proper care. Dismissing it as a phase may delay necessary treatment. Have you ever heard, or even said, any of these without realizing the harm? That's okay. Awareness is growth. You're learning, and that's powerful. So what can we do? We can learn to listen without fixing. We can ask, "How can I support you?" instead of giving advice. We can encourage professional help gently. We can show up, again and again, even if we don't always understand. And if it's you who's hurting, please know, asking for help doesn't make you broken. It makes you human. Treatment works. It may involve therapy, medication, lifestyle changes, or all three. Cognitive behavioral therapy, CBT, for example, helps people reframe distorted thoughts. Antidepressants help balance brain chemistry, and support groups can remind you, you're not alone in this. Mindfulness is one small but powerful tool you can practice anytime. Mindfulness means noticing what's here, without judgment. When you feel the weight, pause. Breathe. Ask yourself, how am I really doing right now? You don't need to fix it all. You just need to show up for yourself. Try grounding with your senses. Feel the chair beneath you. Notice the sounds around you. Taste your coffee. These moments bring you back when your mind wanders into despair. Self-compassion also plays a vital role. We're often our own worst critics, but healing asks us to become gentler with ourselves. Try saying things like, "It's okay to not be okay today. I'm doing my best, even if it doesn't feel like enough. I deserve rest and support." Sometimes, simply recognizing your pain without pushing it away can be the start of healing. Let's not forget how important connection is. Loneliness fuels depression, while connection soothes it. That doesn't mean being around crowds. It means feeling seen, feeling heard. Even just one safe person can make all the difference. If you're supporting someone with depression, don't underestimate the power of your presence. You don't need perfect words. Just be there. Remind them, you're not a burden. I care about you. And if it's hard to say, write a message, leave a note, send a voice memo. Now, let's take a moment to reflect. Sadness and depression are not the same. Sadness is a part of life. It comes and goes. Depression is an illness. It lingers, it distorts, and it deserves care. One does not just get over depression, but with the right support, it can get better. Life can feel meaningful again. Color can return, and the person who felt lost can slowly find their way back. So if you're listening and you're struggling, you're not alone. You are loved. You matter. And help is out there. And if you're listening because you want to understand and help someone else, thank you. The world needs more people like you. Let's stay mindful. Let's stay compassionate. And let's keep these conversations going. You've been listening to Understanding Depression. Take care of yourself, and remember, healing is not a straight line, but every step counts.